It's working, hooray. So hello to everyone and welcome to Banter 2.0. I like that. It's kind of like the sequel.
Oh, yes.
I'm Avril Flynn. I'm a midwife and childbirth educator. And I am here with my lovely colleague, Kitty. You go, Kitty, now.
So I am, oh my goodness, I always feel like I need to have a little spiel ready to go, but it changes every time. So in order of importance, I'm a mum. I am also a registered general nurse. I'm a lactation consultant. I'm a hypnobirthing educator, antenatal educator, and I'm a birth and postpartum doula. So that is me.
That's pretty amazing. That's like a very, very long list. But we were delighted to be invited back by Kaliedy, who are a really, really brilliant brand and who are championing what I love about them as well. They're championing Irish brands. And it really is one-stop shop for all of your baby needs. And they're doing these lovely series to kind of have a chat with myself and Kitty and go through stuff that is important to you guys when you are preparing for your little humans arrival. So today what we're going to do is we're going to talk about 4 topics. I'm going to talk about 2, Kitty's going to talk about 2, but we'll be hopping in. Myself and Kitty have a talking addiction. We have as yet. Yeah. So, and also you're really welcome to ask questions and we will do our very, very best to answer all of them. And if we on the off chance don't get a chance to answer them, myself and Kitty will do another live on our own Insta and make sure. So you can ask, and you really can ask anything. So I'm going to be talking about, well, Kitty's going to be talking about birthing. Oh, hold on. No.
I'm going to be talking about the end of pregnancy,
yes.
As a whole, trying to sort of pinpoint little bits, and feeding your baby as a whole. So they're going to be my 2 little chunks. And shall I put myself on mute, Avril, and you can just go and I won't interrupt you?
No, because it's kind of nice when you hop on. I don't want you muted. I'll be talking about baby bags, as in birthing bags, labour bags, what to bring and what to take, and what not to take. And another consideration that I thought of when I was prepping for this is I've heard from a good few of my clients that they have to bring their own bags in because of obviously the COVID restrictions. So first and foremost, have a rolly case so that you are not lifting anything that's that heavy. And I'll also be talking about birthing plans, or what I like to call birthing preferences. Because I think plan, would you agree, Kitty, the word plan, when we tend to say plan, everything kind of goes out the window.
That, and then also another little part of me says, you know what? I think it's kind of great to plan. And why not plan for the ultimate dream birth, but have a backup plan?
Yeah.
So yeah, I mean, it's a word, but it's what it really means to you, and it's the preparation behind it that's so important, isn't it?
Absolutely. And I think the big thing is there is no right or wrong way to plan. That's the first thing. But deciding on the things that you would like to happen, that you would prefer to happen, envisaging your dream scenario is a really positive and healthy way to look at it. And I know, sometimes you often hear from mums to be and parents to be that they might say, oh, I just want a healthy baby and that I'm okay. That's a given. So, we tend sometimes to actually not set our sights a little bit higher. This is your really important life event. And in the same way that you would plan your wedding or a really amazing holiday, or me, I've just after moving house and I had plans all over the place.
Color of the grout in your bathroom was important. No, it is. It's so true though, because you're the person who has to
we should look at our labor and birth experiences with the same kind of dedication and with the same forethought. And that can look, there are lots of different amazing ways to give birth. But what's most important is that you get the information that you need and want so that you can make informed decisions and relay that to your maternity care provider. And I suppose the birth planning starts at that stage. So actually choosing a care provider that can actually optimize your specific needs. What do I mean by that? Well, for example, if laboring in a pool or a water birth, or if you're laboring, if you want to have a home birth, you're going to need to pick a care provider or a maternity unit that's going to support your needs. And while we have limited choice, particularly in particular areas of the country, there are still choices. And different hospitals have different policies and different slants. So, do your research, really try and talk to friends and relatives to try and see who and which care provider can really optimize your particular vision of your birth. Because there's no point wanting to labour in a pool and then you go to a maternity hospital that doesn't offer that facility. So
no harm as well, I think, because sometimes people feel kind of rushed into it, don't they? They feel like, oh my gosh, I've just peed on a stick, and you go into your GP and they say, okay, well, I'm putting your name down for wherever. And I suppose not to feel like, oh, well, that's it now. It's a done deal. We have to go down this route of, birth experience. That you can change care providers right up until the last date. Actually, if you're 38 weeks and you no longer feel comfortable with your care provider, it's not set in stone. But starting the research early really helps you, just even in terms of the stress that can kind of come with not feeling comfortable with your care provider, or not feeling like you're being sort of encouraged in the direction that you want to go.
It's not getting it's as simple as not feeling the right vibes, and you are a person giving birth, but you're also a consumer. Regardless of whether you're going public, private, semi-private, they are offering you and should offer you the highest quality of service. And if you're not feeling the vibes, then change. And that is a facility, and don't feel that you're hemmed in. And then with regards, as you're getting closer, I always would recommend all of my clients keep a notebook, because sometimes you'll have a chat with somebody and you'll think, oh, that's a nice idea. I hadn't thought of that. And then you might get an idea of doing different classes. And myself and Kitty both offer hypnobirthing, and you can start that, really early on. You don't have to wait until, the end or the third trimester to actually do your antenatal classes, although most people do. And also do your research on where you're getting your class, because there are lots of people offering them, and there are some, we're very lucky that there is a really high standard of antenatal educator. But again, just make sure the person giving you the information knows what they're talking about, and can also support you in exactly what you want. The big thing with doing any class is that it's about you and your experience, so that, even in our chat now at the moment, that you feel that all of your questions are answered. And that goes with care provider, it goes with antenatal educator, and all of the things around that. Don't forget, you are the most important person, and your experience is individual, and it's really important that you feel supported, and that will lead you to be able to make really informed choices. So your birth plan can be as detailed or as simple as you like. Some people will just have one sheet with a few bullet points, and other people will have a much more detailed plan. But really importantly, that in your meetings with your care provider from the beginning, but more in the third trimester, because you will be seeing them more often, make sure that when you're going into the clinic, say, I have questions, I want to go through some of my birth preferences and birth plans, to make sure that they give you the appointment time allotted that you need. Because the last thing that you want, and Kitty, you'll agree, is that you don't want to be rushed on this. You need to have all of your questions. And then, the big things are when to really sit down and think, what do I want my birth? What would be my ideal birth scenario? And that's what you plan towards. Obviously, there will be backup. There's always a backup. And that's what your maternity care professional, your midwife, your obstetrician is there for. But you plan for your dream scenario and work towards that. And then you can go through those preferences, that plan, and then they can say, yes, we will try and facilitate that, or that's not something we offer, etc., etc. But it means you're all on the same page. Ensure that they sign it off and that it's put in your chart. So, because people in the clinic may not be the people that are looking after you. And once it's in there, it's a record, and it's a written agreement that they will try insofar as possible to facilitate your wishes and needs. There's no point going in labor with a really detailed plan that you haven't actually discussed, and having the kind of stress of that. Wouldn't you agree, Kitty?
Oh,
Kind of going in and finding out at that point.
Well, a lovely kind of thing is, okay, so you sort of spent all this time going over what exactly it is that is, sort of I always say, your plan A and your plan B, just in the same way as you would for your wedding. Okay, we have this beautiful sort of outdoor garden picnic theme, and then it starts raining, so that's our plan B. But I always think, you've gone into all of this effort to sort of do the research, write it all out and have it down and sort of have it discussed with your care provider. Make sure you have 2 copies. So make sure you have one that has been, sort of either signed off, and you take a photocopy of that for yourself in a separate bag, because sometimes things go missing. So there's one always with the chart, and then there's one that you either hang on to yourself, and just in case it grows legs.
Yes. Yeah. I mean, that's so important. And also it means that if if a shift is changed, or the person that was supposed to look after you isn't available, it's, in your notes, and you have a backup as well, so that everybody's singing from the same hymn sheet. And that when you're focusing on, yeah. And when you're focusing on your laboring and getting through it and having as good an experience that you want, that you're not having to explain to a new person coming into the room, by the way, I want to do this, that, and the other. And, really tease it out. So it's not just how you're going to labor, what pain relief options that you're going to have, but it's stuff like, that you would prefer. For example, I'm a huge proponent, as somebody might know, of skin to skin and of bonding, and, things like having uninterrupted contact with your baby, ensuring that, if you're going down a more gentle birth or hypnobirth route, that your hospital or maternity unit are supportive of that. And they should be, by the way. This is, we are starting, and myself and Kitty are birth activists as much as anything. Choice is really important. But if you don't ask, you don't get. So, if there's something that is really important to you, write it down, ask, and, I hate that word, not allowed, that really irritates me, but that is something that's used. I'm not allowed to. You are an adult, and there's nobody that doesn't allow things. There are different protocols, but you still have choice, and anything has to be done via informed consent. And informed consent means that it's a conversation. It's asking a question, getting an answer, and understanding the rationale behind what somebody is saying. So don't be afraid to use your voice. And that's really, really difficult. That can be really challenging in a laboring scenario. But that's why planning from earlier on, you'll be able to step into your power a little bit more, and, fight for the type of birth that you want. And also remember, I'm not suggesting that, we're not just talking about vaginal deliveries. We're talking about as well, there's choices with regard sections, there's choices in all births. And that's really important, isn't it, Kitty?
Yeah, absolutely. And I think as well as that, I mean, firstly, thank you for bringing that up, because one of the things that I think a lot of soon to be parents sort of think is that the minute that, a cesarean is sort of discussed or sort of being talked about as as a possibility of happening, it's like, okay, well, that's it then. My birth plan's out the window. And actually, I have had so many people recently say, that I actually want to plan for my cesarean. I want it to be family centered. I want it to be gentle. I want it to be, sort of with as many of my sort of preferences as I can. And the thing is it doesn't necessarily mean that everything goes out the window. The birth planning that you're talking about, and the birth preferences that you're talking about extend after that too. You can have postpartum planning. You can have, sort of after baby is here, once they're sort of put up here on your chest, what happens after that? So, in terms of preferences for feeding your baby and things like that, I think just even opening up that as I need to start doing the research, I need to start doing the reading and talking to people and knowing where to go for the information as well is really vital. So, yeah, thank you for bringing that one up. I think it's easy to kind of forget about it. Sort of people think, oh yeah, birth preferences.
Yeah, and just as well, it can be as simple or as complicated as you want it to be. This is about you. This is about your experience. And it is up to us as healthcare professionals, and it's up to the maternity units and the midwifery-led units to support choice and to actively be opening our minds to different ways and different wishes. So, don't ever be afraid to throw it all down, no matter what you want to happen, put it down. And, there's a huge, thing that I love, putting things out into the universe. There's much more of a chance of them happening if you've put them out there than not. So that's my birth planning, birth preferences.
And where can people go to? So, okay, here I am. I'm ready to go. I'm really excited now, Avril. I want to start thinking and planning and, creating my dream birth scenario and, doing a bit more reading. Where should I start? Where do I get the information? Is there such a thing as, like, say, if I came to you maybe and said, I want help creating birth preferences, would that be the right route to go?
Absolutely. In any of your antenatal classes and any antenatal educator, that's one of the really big things that we help you tease out and also explain the different choices that are involved so you can begin to make an informed choice. Also, the AIMS website, so the Association of Improvement in Maternity Services, they have a kind of a pro forma. So they have lots of different choices that you can go on. And even if you just simply Google birth plans. So they're on lots of the really good websites like babycentre.co.uk. They have lots of ideas of different things that you want and also the different scenarios that might happen. So as Kitty said, you can plan for the wondrous, best case scenario, and then you can have your plan B, your plan C, your plan D. And, if this happens, what would I choose? If this happens, what would I choose? And wherever you get your antenatal class, be that in hospital, be that from somebody else, they should really, really help you so that when you finish your classes, that you have a really good idea of the things that you would like to happen and the decisions you might make if things have to change.
Yeah, it's the bread and butter of what we do, isn't it?
Yeah, absolutely. Yeah.
Yeah, we're what we
And
do.
yeah, so now on to Kitty and later stages of pregnancy. And then I'll do
Yeah,
bags. Yeah.
perfect. Okay, I realize I've got you guys on a tripod. My tripod is slowly drooping, so if I start to look like I'm doing a little bit of this, it's not me. I am much more perky than that, I promise. Like a sort of wilting plant. So I'm going to talk a little bit about. I was sort of thinking about, because there's so much involved in that final leg of pregnancy where it all of a sudden starts to become quite real that, it's not going to be just us anymore. or if you're a parent already, that there's going to be another little person added into all of this, and I'm going to have to birth this human as well. So I think one of the biggest things that I come across, and I think you probably come across as well, Avril, is that feeling of fear around birth. And research tells us that up to 80% of new mums or soon-to-be parents experience fear around birth, particularly in that final leg of pregnancy. So I suppose it was something that I wanted to kind of address, and I wanted to give you some sort of tools in terms of how can we move past this. And of course, it's really important to mention that it's very normal, but a lot to do with birth is actually about unlearning. So our bodies are much more capable than we give them credit for. And if you want to break it right down, you have already done the hard work. You have built 4 chambers of a heart. You have built 2 kidneys. You've got this perfect little human. And when it comes to birthing this human, it's about a case of one muscle, so your uterus, and all those sort of lovely, fibers, the longitudinal fibers, and kind of cross-sectional fibers, squeezing and releasing, and squeezing and releasing. And as your baby comes down, 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 and out, that is it. That's the easy part. It's just a case of creating that toolkit around how you can support what your body already knows how to do, and really looking quite closely at what are your fears. And I'm a huge advocate for the more you know, the less you fear. So education is it's paramount, and I always feel like when we look at that toolkit, that kind of, the sort of collection of things that we're gathering throughout our pregnancy that make us feel sort of a movement towards less fear and more towards confidence, it doesn't necessarily have to be my TENS machine and my aromatherapy oils. It doesn't have to be physical things. We're also talking about more education. Is more education what I really need? If I did another class, maybe I joined another hypnobirthing class, or if I started listening to maybe my hypnobirthing meditation tracks, or maybe it's about for you, yes, education is great, but you know quite a lot. Maybe it's about feeling really strong in your body. So maybe it's about making sure that you can join a prenatal exercise class or a Pilates class. It's not just about the hands-on stuff, and it's about surrounding yourself with support too. So I always think, it takes at least 10 positives to make up for 1 negative comment. So if you have, all of these gorgeous people who are surrounding you with love and lots of you can do it, and I had a fantastic experience, and just wait until you got your baby in your arms, and I found this really helpful, give that a go. And then one person says, oh geez, just you wait, da 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 da, and you're going, oh my goodness, Bridie from down the road has told me this thing, and that's all I can think about. So I think learning how to address that conversation, while it might be sort of social distance at this stage, and it might be where you're going for a walk with your dog when someone mentions it, because we all know that everyone and their dog wants to tell you about birth and their negative experience when you're pregnant. So I suppose learning how to navigate that conversation is something that people don't talk to you about, and people don't, it's something that you just sort of think, gosh, I have to listen to all of this stuff now. So a big thing that I always think is, you know what? Saying no to that conversation for now doesn't mean that you're a bad person. And in fact, you can kind of spin it on its head a bit. And, if you were to meet, for instance, Bridie down the road, I don't know any Bridies, I always come back to Bridie, poor old Bridie. I always think, okay, so Bridie's telling you, she just goes to open her mouth and say, well, when I had my Bobby, and, is just about to sort of launch into her big story, that you can say, hold on a second there, Bridie, I would absolutely love to sit down with a cuppa with you once I've had my baby, and we'll share birth stories, but I'm really doing everything that I can to surround myself with positivity around birth at the moment, and once I've had my baby, then I will better be able to listen to you with more empathy, because I'll be able to have experienced that myself. So it means that actually you're just being a really good pal, and you're being supportive of her and her experience, which she so clearly wants to share with you, and acknowledging that, and making sure that you're creating space for that too means that you're not becoming the person who just says, no, I'm doing all this and I'm better than you, which is not what we're, suggesting at all. But surrounding yourself with that positivity is so key. And that extends to other areas of your life too. So to what you watch on TV. I know, myself included, I was glued to the Rotunda when it came on, and One Born Every Minute, because I was just so fascinated with everything around birth, which is what often happens, which is where a lot of kind of people decide to sort of change their careers once they've had their babies, because you develop this new fascination around birth. And we kind of forget that those shows are just that, they're TV shows. They are dramatized versions of birth. You have to add in the guts and the gore and the screaming and the big, hoop-de-la events, because if they just filmed women coming in, breathing through their surges, hopping up on a bed and pushing their baby, that wouldn't be great TV. People wouldn't click on it. It wouldn't get, a 5-star rating, because it wouldn't have the dramatic effects. It wouldn't have that, added sort of excitement that we all want on TV in the evening, seemingly. So I suppose thinking about, all of the different influences that you have in your life is really, really important. And knowing where to look for information is something that you kind of just touched on there, Avril. And I think Dr. Google is wonderful and awful in the same breath, because it's something that I hear about a lot. Is it's hard to know where to go for the information when it comes to pregnancy, birth, and particularly that postpartum period. You Google something, my baby's got X, Y, and Z, and all of a sudden you've got the worst case scenario and you've got yourself in a flap. When actually, had we known where to go for the information, we would have been in a very different situation. So like that, when it comes to your education, coming back to your education providers, so like that, if you've done a kind of a private antenatal preparation course or a birth preparation course, that is what we do. So if there's a little bit of information that you want to kind of be sent in the right direction of, that oftentimes just sending a little email or a message to your care provider or your educator, we're more than happy to send you in the right direction. I know I'll often get emails just saying, hey, or particularly Instagram messages actually, which I'm sort of struggling to keep on top of at the moment. So don't bombard me. But, being able to send people in the right direction gives me a huge peace of mind too, because I know that you're not going to go and just Google and go down the dark hole of, misinformation. And pretty much anybody can put stuff up on the internet nowadays. In as far as if you wanted to change something on Wikipedia, we could. So it's dangerous. And knowing some sort of great places to go for information. Gentle Birth have a fabulous website. Sarah Wickham has some superb stuff on hers. She is a researcher and a midwife. We have evidencebasedbirth.com are fantastic. And then both Avril and I have, our own websites with blogs and things like that. So it might be worthwhile kind of following Instagram accounts that also have sort of an evidence-based point of view, as opposed to just from, a personal perspective, which is also very interesting. But it only takes 2 seconds to type into YouTube my postpartum experience and my birth experience. And that's not necessarily where you should be getting the majority of your information, while a lot of people certainly are. They're following their favorite blogger or YouTuber, and that's where they're getting the information from. That's fantastic, but just making sure that you're also, getting sort of the 80% from evidence-based information, as opposed to just someone's experience. Yeah, so I suppose that's I've waffled on for 15 minutes. I'm so wary of the time. I haven't even taken a breath, Avril. You need to stop me.
So you're so interesting. Like I concur with every single thing that you're saying. Like, go to experts to get your information, and try and make your space around you. Like I always equate it to, if you heard somebody was going on holidays, would you say, oh, did you hear about that plane crash? But yet when we talk about birth and the fear around birth, we all feed into that conversation. So it's also for us to be mindful of and conscious around people, and that, every experience is a subjective one. And just because this one thing happened to one person doesn't mean that it's your experience, and that's the amazing thing about every single birth. So there are like nearly 9 billion people. Every single one of those little babies, it was a totally unique experience. So yours will be too. And, it is really possible to have a really wonderful birth experience. And that doesn't mean that everything, like we talked about in birth plans, that everything goes. What actually makes a great experience and in the latter stages of your pregnancy is you feeling in control, you feeling supported, you feeling cared for. But again, you have to, I suppose, be the gatekeeper of what you kind of let into your space. And just, if you're following somebody on Instagram and they're not, it's not going to hurt their feelings to unfollow them, and just be really wary of particular forums or groups. Anyone, you could have Ted from Texas purporting to be a breastfeeding mom, they're not validated people, so you don't really know. So just be really wary of kind of unvalidated forums. So ensure that the person that you're getting the information from has an evidence-based background. And there are some great websites.
Over, followers. Don't get me wrong, it's lovely to have everyone who's following me, but I always think that, okay, just make sure that you're following me for the reasons that, you believe what I say, because you know where the, that we've done the study. And I think that's something that it's easy to forget sort of nowadays, isn't it?
Oh, totally. And, everyone can be a blooming expert, but make sure that they actually are, and also it's, you can really enjoy, like, it's a beautiful time, that later stage of pregnancy as well. Even though you can be tired and feeling big and everything, if you surround yourself with like-minded individuals, it can be a really beautiful experience, and a very like, I talk a lot in my class about helping people find their inner birth goddess, but I really mean it. It's really possible to feel amazing when you've given birth, and I don't think that's the story that we hear a lot of, and we need to hear more of it.
Totally agree. I would love to hear what you would pack in your hospital bag.
Well, I think first we will offer everyone a little 5-minute break, just to go to the loo, or to go grab a cup of tea, or change a nappy, yours or your little person's, and just take a little break we'll click off for like 3 minutes, 5 minutes. And give people a little break, or we'll just continue yapping, because we have done our Kegels all through our life, so we have a good pelvic floor. We don't need to go all the time.
I need reminding all the time.
I have a thing on my phone now. So
yeah, I was asking Tom for tips the other day. She was saying, stick it on your mirror in your bathroom, which of course I have never done, and I still need to do. That's good. Did you do the squeezy app, or did you just put a little app on your, or a little reminder?
Just a little reminder every day, twice a day. It gives out to me, basically. So yeah, I mean, I've had like a sieve anyway, so
Oh, stop! It's so funny, because I was like, oh, baby brain, that's not a real thing, and then I was like, oh no. My memory is shocking. Yeah, I would forget my own head if it wasn't attached to me, genuinely.
Yeah, I like the packing. I've just moved house, for anybody that cares, but oh my God, it was so stressful. But I'm very organized, and I had lists and everything, and I know there's still boxes everywhere, and I was trying to find my makeup.
Oh, no.
But I found it, not in the place that it should have been, but because you're very organized.
Did you have a system? Did you have like a sort of things labeled, certain colors of tape, or certain for each different room?
Yeah, just wrote on boxes and stuff. But it just accumulated a lot of rubbish. You just have a lot of stuff.
Stuff. Yeah, and we're here a year and a half now, and I still have like, oh my God, what's in that box? And then I kind of take a moment and I go, well, I obviously didn't miss it. So
Literally, and I'm not buying
it's
any, I'm banning myself from buying any clothes. I had like, because we lived in a tiny apartment, so a lot of our stuff was in storage. So I took it all out of storage, and oh my goodness, like that's like I have boxes ready to give to charity shops. And so no, I'm not buying anything.
it's quite interesting. I think after you have a baby as well, you realize that like, gosh, I really only wear about 3 outfits. And you're so you're minding this person, they've got the perfect sort of cozy jacket, and they've got a summer jacket and a winter jacket, and they've got the perfect belly boots for every occasion or whatever it is, and you're going, God, I haven't bought knickers now in a good 10 years. So that's kind of nice though, for you to bring all this stuff out of storage and maybe have a little bit of a route through. And
absolutely, and it's kind of walking down memory lane as well. But I just on brain fog and on baby brain, I was reading a really, really interesting paper on the kind of the connection that 80% of your brain matter is fat. And if you aren't feeding yourself with the right, and when you're growing a human, you're growing their brain. So, to ensure that you're making sure that your diet is giving you lots of all those good fats, so that that you're feeding your own mind and your own body with stuff. But it was a really interesting paper. I'd love to see more research done on it. But I also think as well, when you're pregnant and when you've had a baby, you're sleep deprived in the main, and you're constantly thinking of so many different things that, my head is just like a bloody sieve if I don't write it down.
But if you found a way to do it, I feel like apparently as well, it means that we're better mothers. It's because what it means is you've got sort of a large portion of your brain dedicated to just this sort of nurture part of just keeping this baby sort of alive and well and doing. Yeah, I love that. I'm running with it anyway.
You're a better mom. I like that a lot.
Yeah, that's what I say to everyone who's, I'm so sorry I'm late again, blah, blah, blah. I'm like, just all I see is that you're a fantastic mother, and because I'm also very, very good at being late for things.
So on to hospital bags, birth bags, labor bags. Even if you're having a home birth, you still should pack a bag. So as you can probably tell, I love lists. A, because I'm very forgetful, but B, again, it's a lovely, I almost think packing your bag is kind of, there's a ceremonial aspect to it. It's like when you're going on your holidays, when you're putting everything in the bag, that you're imagining all of that. And it's no different for your maternity bag. So for a start, it's bags. And I would firstly, get a nice bag for yourself. You deserve it. If I felt very grown up when I had been lugging around this one little wheelie case since I was in college for the first time. So by the time I had Felix, it was like really looking pretty haggard. So I treated myself to a lovely new bag. And, some of the stuff that you're going to put in the bag is obvious. And some of the stuff then will be very particular to you. But start the prep early, because it can take time to pull everything that you want together. And also plans can change, as we discussed in the first kind of segment, your birth plans, things might alter. So the needs of what is contained in your bag might change. Second of all, you don't have to pack everything in the kitchen sink. The big things are to ensure that the main important things, such as night dresses, so things to labor in. So you have, what I always do is I have a bag for the baby, then I have my bag separated into two. I have my labor kit, and then I have my postnatal kit. So for labor kit,
the idea actually, particularly for the moment, because you could technically just go up with that little bag, couldn't you? You wouldn't have to worry about your big wheelie bag. That's great.
Absolutely.
Let's bring all that up.
Yeah, absolutely. And it like already you are not going to be weighed down with everything. And they'll just have it in the boot and they can bring it up to you when you go to the ward or when you're going to your room or whatever. So don't, you know, separate things so that you're not lugging it ever. And then label everything and put everything into its own little section. So put it into paper bags or plastic Ziploc bags or whatever. I'm trying to be environmentally aware, so try not to overuse plastic, but separate everything, because it means
These awesome things from Amazon. They're little cube separators. They're, oh god, what are they called? Cube organizers, and they're literally little like zippy reusable bags,
brilliant.
and we use them for when we were doing a little bit of traveling, and they're just fantastic because you can, you know, you can see exactly where everything is, but they're reusable. So yeah, that's a lovely.
It also means that if your healthcare provider, so your doula, your midwife, or your birth partner, if they need to get you something, it's there. They're not rifling through going, is it this one? Is it this one? Is it this one? And also to do nice things for yourself. So for example, your toiletries. So obviously in your toiletries for your labor, you're going to have some lip balm, you're going to have some face spritz, you're going to have, I'm obsessed with skin, so I had like moisturizers and all sorts, but whatever, you know, you feel you need yourself, and have that separated into one little section, hair bobbins and stuff like that. And then for postnatal, have lovely things. So go and do a bit of a little splurge, buy yourself a little travel size of a lovely shampoo, a lovely bath or shower gel, a lovely fresh hair tie, lovely, you know, or even go and ask for samples, you know, because sample size can be great. But you know, and what I put on in that little section of my bag, I put a little message on going, hooray, you did it. And it was so lovely when I was packing it. I was so excited going, God, the next time I see this, I'm going to have my little person. And again, there's a ceremonial aspect to it of going like, you know, I'm important. I am, you know, it's really that you see this as a real important thing that you're putting into your bag with things that you're going to want and need. On a practical sense, for your postnatal bag, you're going to need obviously some nightwear, but you don't have to wear a night dress after you give birth. You can wear your normal comfy clothes, but you know, so because sometimes when we think of hospital, we think of patients, but you're not a patient. You're someone who's just given birth. So you're not actually sick. So it's totally fine that if you want to put on a loose dress or whatever postnatal, you know, don't just assume that it's nighties or jammers. But very importantly, you're going to need some massive, really comfy cotton granny pants. And I'm talking like, even if you are a size 8 to 10, you're going to buy size 24, and you can get them for tuppence in pennies is great. But at the moment, obviously, we can't have pennies, so you can buy them online on lots of the different stores. And I know Kaliedy have lots of ranges of different stuff as well. But the reason that you need that, so no matter how, whether you give birth vaginally, whether you give birth through your tummy via C-section, you're going to need comfy pants, because you're going to be wearing quite thick pads. That's the other thing that you need for your bag, is big, thick, I call them the surfboards, for postnatally. Now, obviously hospitals carry stuff, but you will need to bring your own. And then obviously you're going to need towels, so dark colored preferably, because they hide a multitude. And then obviously I mentioned the postnatal, you know, your shower gel, your lip balms, your shampoo, your conditioner, toothbrush, toothpaste, deodorant. I have not an exhaustive list, but I have what I rely on, and I'm going to send that to the lovely people in Kaliedy, and hopefully they'll be able to email it to all the panels, because I suppose it's a good one to work off. And then there are some that you might not think of. Make sure that you have coins for parking. I know a lot of us we're all contactless now, but some units still need coins for parking. And also, very importantly, snacks. for both you and your partner. So obviously if you're packing your bag early, you don't want them to be perishable goods. So don't be chucking in some bananas when you have another possibly 6 weeks to go. But if you can get like things like nuts, things like, you know, things that are going to offer you lots of really good fats and proteins, and are going to really support you in your laboring experience. And one of the very old school thing that I know you hate as well, Kitty, is this: you're not allowed to eat during labor. And there are some circumstances, if you have particular types of pain relief, some, you know, you're not allowed. But generally it's actually really nice. You know, you're going to be laboring for a good few hours, you're going to be hungry, and the LT and toast is nice, but for afterwards, not for during. Would you agree with that, Kitty?
Oh, totally. Yeah, no. And it's funny because I would always say, you know, what do you pack? What do you pack? And I would say, stay away from anything too exotic. You know, you want something that sounds good to you now, because the likelihood of it sounding good to you then, you know, when you're in labor is massive. So yeah, not trying anything kind of too new and too fancy, and something that's easy to grab, because you might necessarily want a whole meal. So something that's sort of light, easy to digest, and like that, got that nice mix of kind of complex carbohydrates and a little bit of fat in there to kind of give you more energy over a longer period of time.
And also avoid things, you know, one of the very common things that happen when we're laboring is sometimes we can feel a bit nauseous, even if you don't have particular types of pain relief. Because remember what Kitty was saying, you have that really amazing muscle that's contracting, relaxing, surging, relaxing, surging, relaxing. And that's right beside your stomach and all of your intestines. So you can feel nauseous. So if you are, you know, chugging down crisps and choco, that's not going to be very nice if it's coming back up. So yeah, and things that are light and nutritious. So sometimes there's some really, really lovely of those kind of protein bars and stuff. So they're light, but really, really nutritious. But obviously make sure it's something that you like. Because the last thing you're going to want is, oh, try this new fancy thing, put it into my labor bag, and then like, no thanks.
For afterwards too. I mean, what was your first meal after birth, Avril? What was your, because you know, it's something that we were talking about the other day, and I was thinking, gosh, that's a whole other conversation.
Well, obviously the first thing I was good at LT and toast with lashing butter.
After that, did you bring something with
but
you?
I actually sent my husband down to get a very nice Thai. Actually, I had a massive big bowl of.
Oh my gosh! Now I want Thai food.
It was absolutely gorgeous.
And you know, bringing with you something nice as well. You know, sort of. You know, and like in a little kind of lunch box, you can always sort of have something ready to go, and you can just bring with you. And or we did smoothies, so we could have sort of pre-made smoothie pouches, and we had them in the freezer. And then, you know, if we wanted them, we'd sort of leave them out to defrost. They were cold, and I always bring them with me to clients as well, because it's that nice little hit of sugar but also hydration. But bring something for afterwards, because particularly if you're giving birth in the hospital, the food is, while mostly nutritious, isn't always delicious.
Yeah, I mean, some are better than others, but some of it is. And like when, you know, it's giving birth, or you know, and giving birth via section as well, because you'll have been fasting for a little while before that. You can be absolutely ravenous, so you know, you'd eat like the leg off the table. So you know, make sure that you have a think about things that you might like, so that you can let your birth partner know that. And then practical stuff, obviously, as we said, have a copy of your birth plan, details of, so your hospital notes if you're carrying them yourself, or a list of any medications that you might need or might be taking, because remember, in maternity units, while they carry a lot of medications, sometimes they don't carry all. So particularly if you're on anything, you know, for any particular medical ailment, make sure you have a copy of that and the medications that you're going to need. I would always go for kind of the older, you know, an older loose dressing gown, you know, something that's dark colored, because you know, as I said, you're going to be very active, so you're going to sweat a lot, and the creams and nice little chemise tend not to be very practical. Sometimes people love to labor in the nude, and you can absolutely do that. And sometimes people don't like that, so you might just want to wear something on the top. So, you know, tank tops or a tankini can be really, really great. And obviously then if you're laboring in the pool, that's good for dry land and for the pool. And obviously hair bobbins or hair scarves, which as you can all see, I'm obsessed with. Water. So while they have endless supplies of water, sometimes they give it to you in a piddly little cup, and I drink gallons of the stuff, so that's just not going to go. So make sure you have a nice big water bottle that people can fill for you. You're going to obviously bring your TENS machine, bring speakers or earphones so that you can listen to your gentle birth or hypnobirthing tracks. And also another fun thing to do is make a labor playlist. And I'm not just talking about, you know, calming music. Well, absolutely that can be, but I always think as part of that ceremony of getting ready, making up a playlist that reminds you of really happy, lovely times. So for example, you know, songs that remind you of when you found out that you were going to have a baby, and songs if you're with a partner that mean something to you, because that's going to really help us all get that oxytocin flowing when we're surrounded by things that give us happy, warm memories. Then, and you know, and play it not just during labor, but you know, in the preparation up, because it's going to be familiar to you, it's going to help you relax. And then obviously baby stuff. So again, you don't need to take in, you're only going to be there for a very short time, and your partner, hopefully, if they're able to visit, or even if they're not able to visit, they can leave things for you. So don't think that you have to bring enough for your, you know, till your baby's 4 months old. So bring, you know, roughly six of baby grows, 6 vests. And that kind of is a coverall. Bring a cardigan and a hat for going home. Bring a blanket for you know, in hospital and for going home. But remember, hospitals are really, really warm, particularly maternity units. Don't ask me, but it feels like it's the blooming Bahamas. That's, I think, one of the main reasons why we all wear scrubs. So you're not going to need your baby to be wrapped up, and hopefully as well you're going to be doing lots of skin to skin. So when you're doing skin to skin, all your baby's going to have on them is a nappy. So, you know, don't over stress, but obviously again have, you know, it's separated into, you know, because particularly if you buy all white or all, you know, neutral colored things, they all kind of look the same. So actually write on, or I've got a new label maker today, which I'm such geeking out about.
I'm so jealous.
And you know, bring as well just a towel for baby and a little sponge for baby, because you're going to, you know, be shown possibly the first bath or how to top and tail them. So it's lovely to have, you know, something like that. And again, make sure everything that you're having for your baby, don't just take it out of the packet. Make sure that you wash it at home with a non biological detergent, because that's kinder to baby skin and kinder to the environment. And also make sure it's the one, your family detergent, because babies have a really keen sense of smell. So when they're on you and whatever you're going to be wearing, it's going to smell the same as what they're going to be wearing. So there's a nice kind of familiarity, I always think, with all of that. As I said, I have my little list, because I know, so I will make sure that's emailed to all of you guys. And then, is there anything that I've forgotten?
I'm trying to think. Nappies.
Oh yes. Well, they do have nappies. Make sure that you have one packet of, and also then of course your cleanser, moisturizer, and if you feel so inclined, although don't feel pressured to, a little bit of makeup, because you might want to just feel a bit kind of back to yourself. So although like I gave birth to Felix around the same time as Kate Middleton gave birth, and I always just felt so awful for her having to stand on those steps in heels, you know, and she looked so lovely, but also I was thinking, you know, she oh, imagine, you know, everyone taking flash photography. So I actually sent a picture to my sister, and it was like, yeah, and it was like me in my massive pants, my massive bra, because it was roasting, so that's all I kind of wore, and then going, yes, we're rocking it, you know, this is actually what a postnatal body actually looks like.
Love it.
um but yeah, but you know,
Love that.
yeah, and just also enjoy the whole ceremony of packing it, but make sure that it's a rolly case so you can wheel it in, it's not going to hurt your back, and keep your postnatal bag separate, so that all you're bringing in is little bag for baby and little bag for you for your labor toolkit.
Fantastic. I'm going to add something to that, which actually I only kind of started to think about as being a thing when I was packing my bag last time. And that was to get your partner to repack it. So I would pack, you know, I did that lovely ceremony and really enjoyed actually putting together all those bits. And I went the whole hog. I put in under eye patches and, you know, a face mask and serum. So I did all this stuff because I was like, I'm going to make myself feel like a goddess. I loved every bit of it, but I actually got Pete to repack it so that he knew where things were, so that, you know, it's almost always the partner who is to go rifling for baby's first outfit and a little nappy for them or whatever, and they almost always end up going through the entire bag only to find out that it was actually on the other side or whatever. So I thought that was a quite nice one, because I suppose it's a degree of sort of a way of getting involved for them, but it's also nice for them to know where things are. So if you are, you know, at the middle of a surge and going, gosh, where's my lip balm, or I need some more water, that they know where that is, so that it's really easy for them to access.
Yeah, that's a brilliant idea.
I hadn't thought about it until I was in it.
Yes, that I've prattled on a bit too long, so we better move along. And obviously, if anybody has any questions, please do fire them up. There's just one here at the moment, which we will absolutely get to at the end. But if anybody has any questions at all,
There's 10 in Q&A.
is there? Oh,
So I'm going to be really short and sweet. We've got loads of questions. It's great. It's great. It's fine. It's fine. It's only I can see it here anyway, so I can just read them out. I'll play the, what's it called, MC role, and I'll read them. So I'm going to talk a little bit about feeding your baby. And, you know, again, it's the topics that we're talking about, we could just talk about forever. But one of the biggest things is, I suppose, from in terms of the bread and butter of what I do, the majority of my work, while I do a lot of sort of education around birth preparation, the bread and butter of what I do is lactation consultancy. So that comes in many forms. It means that I support you in terms of antenatal preparation for breastfeeding. So I would sort of bring you through what breastfeeding can look like, the benefits of breastfeeding, and how to make sure that your baby is getting enough, that your baby's well latched onto the breast, and sort of some of the common breastfeeding hurdles that you might face. But one of the and then afterwards, I would support you in terms of when the baby's actually arrived outside, to make sure that everything is going well, and if there's anything in particular that we work through together. So one of the biggest things that I hear is, but breastfeeding's natural. It's natural. I should know how to do it. My baby should know how to do it. And if something isn't going to plan, you know, there's something somehow wrong with me, or that, you know, I've done something wrong. And the biggest thing that I can say to you all is, if you plan on breastfeeding your baby, to remember that while it is natural, it's also a learned skill. So it's a learned skill not only for you as the breastfeeding parent, but also for your baby. And I have come across so many parents recently where it isn't actually their first baby at all. It might be their third or fourth baby, and they're coming to me with issues. And that's because every child is different. Their anatomy is different. How they feed at the breast in terms of, you know, their own little kind of, their own way of doing things is so very different, that that's why I have a job. That's why I'm still in a job. So don't, you know, for a second think that if things aren't going as planned, that there's something that you haven't done. The biggest way that you can prepare for feeding your baby is education. So it's knowing what it might look like, knowing how to recognize when your baby is well attached to the breast, knowing how do I know when my baby is hungry? How are they going to tell me? How do I know what that is? So learning what your baby's normal feeding cues are, learning how to get breastfeeding off to the best start. So what are the normal things? How might it look when your sort of breast milk is transitioning from that sort of thick, sticky colostrum, that lovely golden sort of goodness. It's like your baby's first vaccine, I always think, versus as it transitions into the more mature milk that we sort of think about, that kind of that white, more liquidy consistency, and how does that whole transition look like? So I would say the biggest thing is antenatal education around that. So check in with your local lactation consultant or find a breastfeeding preparation class so that you can become armed with that information and be able to make a really educated decision for yourself around what way you're going to feed your baby. Breastfeeding isn't, the only way to feed your baby as well. So that if you do decide that while I do want to breastfeed my baby for a little bit, I also want to incorporate a little bit of formula, I would say make sure that you know about that too. So making sure that you know how to prepare formula safely. One of the big things that new parents don't realize is that actually formula isn't sterile. So it means that the preparation is really, really important. So you have to make sure that the water that it's being prepared with has reached boiling temperature before it is then mixed with your formula preparation, and that you have fully sterilized, your bottles, your teats, all your gear. And when it comes to actually giving your baby a bottle, that you make sure that you're doing it in a way that is gentle for them. So I always think that, while some babies and some adults might like to sit down at the dinner table and eat their entire, 5-course meal in 10 minutes, the majority of us would prefer to sit, have a glass of wine, maybe have a cup of tea or a glass of milk with our meal and just kind of chat away. And before you realize it's, half an hour or an hour has gone by. And I know certainly I take forever to eat. So I always think, well, babies are the same, and not only in terms of what's more comfortable for them, but also so when it comes to digestion, when it comes to how much air they're taking in, which of course leads to a less fussy, more comfortable and happier baby, which is what we all want. So using a technique called paced bottle feeding is really important. So what you're doing is, I should have brought my little baby in here with me, but what you're doing is allowing your baby to sort of set the tone for that feed. So you're sitting them, instead of lying them completely back and sort of pouring the bottle into them, you're sitting them in a much more upright position. And the bottle itself isn't tipped the whole way down, so that it means that they have it sort of poured into them. It's at a more sort of level with their mouth. This is ridiculous. Actually, yeah. Where's my baby? More level with their mouth, so that it means that actually the teat is only halfway full. I have a full highlight on this on my Instagram. It's under paced bottle feeding, but it's one of the biggest things. I'm seeing a lot of these very refluxy and sort of diagnosed as colicky babies, and a huge part of that is air intake. So yes, if you are breastfeeding, it can, improving latch and attachment at the breast, babies taking a lot more air if they have a break in the seal around the breast. But when they're also being given a bottle, so whether it's combination feeding or exclusively formula feeding, that if a baby isn't fed in a paced way, that they end up taking more air in, and that means that you're more likely to have reflux and they're much more unsettled afterwards. So do check out that highlight, and do get in touch with me if you want to learn a little bit more about what breastfeeding entails and what might be normal to expect in that first little while. But I think we should get into the questions, because
knowledge is power.
Yes, I'm so sorry that I feel like there's, if more questions come up regarding breastfeeding, we can always address them. But to begin, can you still see me, Avril?
Yes.
Awesome, cool. I'll just read them. So the first one is I believe is probably for me, and then the second one is for you. So the first one is regarding colostrum harvesting, actually, for someone with PCOS who's a little bit worried about maybe having trouble with breastfeeding. So PCOS absolutely can impact breastfeeding, but it doesn't necessarily always. So for PCOS, I would say make sure and touch base with the lactation consultant prior to having your baby. Oh, have I switched you off? And I would say you know, talk through with them about some of the problems that you might encounter. The biggest one being a sort of insufficient glandular tissue that's sometimes associated with those mothers who have a history of PCOS. So generally with that, without going into too much detail, you would see sort of longer, more pendulous breasts, which means they sort of are pointing downwards, less tissue at the top here. So and oftentimes enough of the space between the breasts that you would be able to fit a full palm. So in terms of sort of an anatomical assessment, that's a full anatomical assessment. That's what your lactation consultant would be looking for. When it comes to being able to feed your baby and having enough milk for your baby, it's not to do with the size of your breast, but more to do with how much tissue you have. So you can have absolutely ginormous Pamela Anderson style breasts, but it might be a majority of it might be fat as opposed to the glandular tissue that we really need to make milk. So when it comes to antenatal expression, absolutely. Once you have run it by your care provider that you don't have anything that would outrule you from being a great candidate for this, I would say start antenatal expression around 37 weeks, which means that you're already at term. So if it was to sort of bring on labor a little bit, your baby would be at the perfect, you know, ready to come into the world. And the next one, Avril, is I had an emergency cesarean on my first, and I didn't have much bleeding afterwards. Just wondering if women tend to bleed more afterwards with a normal or vaginal delivery.
Yeah, so that's a great question. The short answer is yes, but let me just explain. So when you have a cesarean section, a lot of the you're given a larger amount of drugs that basically make your uterus contract very, very quickly and firmly, because obviously it's an operation and we don't want to for you to bleed a lot. So whereas with vaginal delivery, that process happens on a much slower scale. So your uterus reduces in size over a longer period of time, and it expels the blood or the bleeding over a longer period of time. So it can appear heavier, but if you actually totted up blood loss for a section and for a whole postpartum period, they're probably pretty much the same. Again, just in, everybody is different, and we call the bleeding after you have a baby your lochia, and it changes over days. And the big thing is that bleeding shouldn't suddenly become heavier after going lighter. So if that were to happen, always get checked out. And everyone has a different normal. So some people bleed really, really heavily for 2 weeks and then it really lightens up. And some people have a much steadier lochia moving forward. But again, once it's lightened off, it shouldn't then suddenly get heavier again. If that happens, always get checked out.
Awesome. We have 16 questions, Avril.
Okay.
So we'll see how we go. Let's just fly through them. I have found my husband right. I found having my husband write the birth preferences with me great, as then in my first labor he knew what I was hoping for, and then I could focus on my body and the birth, and I knew he had my back. That's awesome. Okay, so some of these are just comments. That's a really great idea, isn't it?
A great idea, and it's why we would always actively encourage your birth partner, your husband, your wife, your girlfriend, your boyfriend, or whomever is going to support you, to be really involved in your antenatal classes. They're a really fundamental part of the journey. I work as well as with pregnant women. I do a lot of work with the LGBTQI plus community. So sometimes people are having babies via adoption and surrogacy, and I do a lot of work in involving them still in the process. So even if you're not the pregnant person, you can still be really, really involved, and you are just as important. So get involved, dads, wives, girlfriends, whomever.
Yeah, awesome. The next one is, I'd like to give birth in a squatting position. Are the maternity nurses ready for this? Is it more common than I think? Would you have any advice with the squatting position? So I actually had a birth very recently, and it was in this position. I do think that it's worthwhile adding into your birth preferences for sure, because it depends on the person that you have. So I think certainly some would be more experienced when it comes to, you know, other positions, and are quite happy to catch your baby, you know, if you're upside down in a handstand, it'd be fine. And then other people are maybe a little bit more nervous around that, so it might be worthwhile having, you know, an extra sort of support person in the room when it comes to just catching your baby. Would you agree, Avril?
Yeah, I mean, they should be.
Yeah.
They should absolutely. Any midwife or worth their salt should be encouraging that, because that's actually a really great and very natural position. If you were left totally alone, and most people that you know, are left totally alone generally give birth in a squatting type position. It's a very natural way, opens up that lovely pelvic outlet. So it's great, but just because they should doesn't mean they always are. So really great to put it down that you want an active labour, you want to be encouraged and helped to use lots of different positions. So really important, again, to get those birth preferences and make sure they're written down. But go you, like absolutely, it's and also the maternity beds that you deliver, that you have your baby, that you birth your baby on, they can all be moved into loads of different ways. So you can be on all fours on the bed, you can be in a squatting position being supported by the bed, and again, any birth worker worth their salt will know how to just zip and do that. And then sometimes it's as easy as just having your two support people on either side, and you know, that's a lovely way, or to use bean bags or peanut balls, or there's loads of different ways. And also, again, just a little note that just because, again, you plan, sometimes you might actually prefer to be on all fours as opposed to squatting. So don't be too hard with yourself. If, you know, some people love it and sometimes people are like, I don't feel great in this position. So don't be afraid to mix it up.
That's a really good point. Oh my goodness, I'm losing my spot. Oh, do you know if the rotunda has a birthing pool?
No. Which
No,
is the
only
short.
the pool. And I'm not even sure. I don't think you can birth in the pool quite yet. You can just labour. Am I right, in the Coombe birthing pool?
That is under discussion at currently. So watch the space. Yeah, it's really disappointing that more of the maternity units haven't jumped on board. But we are actively activating and activisting to try and improve choice. So again, that's where you do your homework. If you really want to labour in a pool, make sure that you go to a unit that supports that choice, because there's no point wanting it and then going, oh no, we don't even have it here.
Yeah, totally. And shouting it from the rooftops, letting people know about it so that they're aware of what your desires are. Do you recommend the Squeezy app? I haven't downloaded the Squeezy app. Have you ever, Avril?
No, but I would be very interested to give it a
Things.
whirl.
Yeah.
I must Pam would be she's our pelvic floor queen.
She does recommend it. She does recommend
So
it.
then if Pam recommends it, I
Actually,
say it, but I haven't tried it out myself, so I would be telling a fib if I did. But if you do try it out, do let us know how it goes, because I would love, yeah.
Is it always a good idea to have a birthing plan, or is it okay not to? I'm worried that if things don't go to plan, that it might be upsetting or disappointing. This is such a valid question, and something that I think, you know, it's an opportunity for us to reiterate the importance of what actually creating birth preferences is all about. And it's a huge amount of it is the education, isn't it? It's not that piece of paper necessarily. It's knowing what you would like, and sort of the research that goes behind it, the research and the preparation of it.
The big thing is, don't be afraid if things go off your dream birth, because a good birth plan is going to have a plan B, a plan C, and thinking about those things when you're not laboring will give you much better clarity to know the right decision. Because if you're trying to decide when you are in that moment, it can be quite hard. But when you've thought about something, then it's easier to make that decision. So while absolutely, if you don't want one, don't have one. You don't have to have one. but it is a really good idea to just even write down a couple of things that you might
what your options are too, isn't it?
yeah, absolutely. And just even to think about things, I think sometimes there's a misconception that, ignorance is bliss with regards, that awful leave your dignity at the door and they'll just do what they want to do. And that is just, it just actually gives me a headache. I'll just reiterate, you are so important. Your experience is so valid. Your wishes, your wants, your desires are all so important. But if you don't ask, you won't get.
Yeah, absolutely, absolutely. And I think as well, there's a lot to be said for having your plan A, plan B, and plan C, having those preferences for every eventuality, whether that's if you end up facing induction, what you're okay with, what sort of modes of induction you're happy with, when it comes to possibly a cesarean birth, what you would like in that instance, that you can feel empowered and positive around your birth, no matter what way it looks. Birth is birth is birth, and it's your birth.
And that's if you end up having, that you really wanted, for example, to have a drug-free, in a squatting position, and then actually when it came into it, you ended up being induced for whatever reason, and then you ended up getting an epidural and then ended up having a section, you can still look back on that and have had a really empowering, amazing experience if you feel supported and if you don't feel kind of panicked or worried. And how we avoid panic, fear and worry is by planning.
Absolutely. Yeah, I love it. So the next question is, I packed my labour bag and hospital and baby bag and I have lots of snacks in them. But what is the story with eating during labour? Is snacking permitted? I feel like I could totally use snacks for energy. And yes, absolutely. I mean, the big thing is it's the biggest marathon you will ever do, and you wouldn't run a marathon without fuel. And your uterus is a muscle, so you've got to fuel the muscle. There are, well, I don't know what your research or your experience has been, Avril, but there are some hospitals that are still a little bit behind the times on this, but the evidence tells us that we should all be snacking during that.
We'll always go back to the evidence. So the evidence is that you burn a lot of calories when you're giving birth. So it's really important that you feed your body. And exactly like when we take a big deep breath in, that we're letting all of that oxygen go down to our uterus and into our babies. Why would we think that by starving somebody, their muscles are going to do a better job? So it's totally counterintuitive. However, some units are very pro forma. By that I mean they've done something for years, so they will continue to do it for years, and they will say things like, oh, in case you end up getting a cesarean section, we don't recommend rubbish. It's total crap. The actual evidence will always be what we go back to, and it's totally safe and in fact encouraged to snack when you're laboring. Now, don't do what I did, which is I did a huge amount of my laboring at home, and I wanted chips and steak, and I ate about 4 dinners, which I was quite surprised at. Yeah,
that's really quite impressive, particularly when at the end of pregnancy there's not a whole lot of space.
I remember like really strong surges, and I would be like in between just chortling down a big burger. Gross, but worked for me.
Well, it's what you needed.
Not recommended, by the way.
Like, we need to fuel up.
Yeah.
And I think as well as that, with the biggest fear and the biggest, when it comes to sort of fear mongering around birth, there's quite a lot of it. And, like that, if that card is pulled, well, if we need to go for cesarean, the risk is aspiration. When it comes to the aspiration of stomach contents, it's quite old in terms of the worries and the fears around that. And what they actually give nowadays is something that it breaks down the acid content in your stomach, which is the primary thing. Yeah.
But also remember that there are occasions that somebody might be planning a home birth, and then for whatever reason they might have to be transferred, and they'll have been eating and snacking, and they don't aspirate. Aspiration is such, you've more chance of like spraining your ankle walking in to than that happening. So don't let the scaremongering, always go back to the evidence, and also stand your ground. Like, they can't physically grab the protein bar out of your hand, like, so if you need to eat something, do.
The next one that we have here, Avril, is just regarding the use of, the tenna knickers, like the incontinence wear underwear, instead of using sort of like your regular sort of big black granny knickers. Um, I know I would always say use the pads in the early days, particularly while you're in the hospital, so they can be checked quite easily, because they are white. And I know some of the tennas are actually black, which means it's more difficult to assess blood loss. But I'm sure you have another take on that.
Yeah, absolutely. And a basic thing, expense. Tenna ladies are really dear, whereas maternity pads aren't, and they're easy to change. They're easier to change because you can just take out the pad and put in a fresh one, as opposed to having to take off, your
As far
pad
as your ankles.
yeah. But again, it's about choice. So if you think that you would be more comfortable with that, then do it. But I would just be a little bit concerned, particularly in the very initial, that I don't know if they would actually have the absorbency that you might require or need.
You could use them after, maybe after sort of day 3 or so, they might be
Yeah,
ideal.
yeah. And then I've clicked on it, right, so I can see them now a bit late in the game.
Oh, amazing.
So
Go
for
for
your
it.
hospital bag, how many newborn sizes? So this is a really good question. So just to say, very oddly, every shop, there are no standardized baby sizes. So what is newborn in one shop might be 0 to 3 in another. So I'm thrifty, so I had actually borrow like all of Felix's initial clothes are all secondhand, so they're a bit shrunken anyway. But a safe one is 0 to 3 months, unless you have a family history of smaller babies. And then like babies don't mind if it's a bit baggy, and if it's too tight, you can just cut the toes off it. So don't try not to stress too much. And a nice blanket. Invest in a lovely blanket, because remember, you're going to be skin to skin, and if you have a lovely blanket, like poor Felix Flynn spent, because he was born in that heat wave, he literally didn't wear a shred of clothes until he was about 4 months old, because he was either skin to skin, breastfeeding, or just bloody roasting the poor wee fella. So yeah. So would you agree with that? And also, as I said, just pack 6 of just one size. I wouldn't bother getting loads of different sizes.
Absolutely. And I think the thing is as well is, okay, yes, we're in the middle of a pandemic, but baby wear is still considered essential. So I know we were planning for this massive chunky monkey baby, and actually Atticus was primary size. So he was 2.8 kilograms. And all we did was get someone to fly down the road to Tesco, and he had his first outfit from Tesco. So it wasn't, it's not, 0 to 3 months, they'll absolutely fit into it at some point or other. And if they don't, then you run down the road and get something else. But yeah, it's definitely thrifting is the way to go. And as adverts, we got a big bundle of lovely stuff from there. So secondhand stuff, gorgeous.
And also there's another kind of similar question. Packets of nappies vary in amounts. So I would bring in 1 packet of the 24 size. Don't bother bringing in the 50. You're not going to need that much. And in the unlikely event you have a baby that piddles to beat the band, and you go through your 24 nappies in 2 days, somebody can run down to the shop for you and get them. And within each of the maternity units, they always have a hospital shop that sells baby stuff, and sells outfits. So don't sweat the small stuff.
Yes, Avril, we're getting more and more questions. There's 18 now. This is good though. So in addition to a good diet and rest after birth, are there any other recommendations to prevent mum depleting of energy, nutrition, etc., especially when breastfeeding? Tips to assist with recovery for mum and ensure hormones level out again after birth? I mean, I think you kind of said it all. And once you prioritize that, and asking for help as well, and postpartum preparation is huge. So making sure that you've got a freezer stocked full of lovely, healthy, nutritious meals, having a little system where you have, maybe a sort of nursing station, so you've got easy to grab snacks, you've got your water there. learning about laid back feeding, so that if you're breastfeeding your baby, you can relax all in laid back feeding position. When it's done correctly, you can relax all of your muscles, right from your jaw right down to your toes. So if you are, doing that, it means you're getting a lot of rest at the same time. Easier said than done, but sleep when the baby sleeps. Invest in a postpartum doula. Anything I'm forgetting there, Avril?
Just with regards, if you were taking any prenatal vitamins, you can take them postnatally as well. And there is actually very little difference. So I do a bit of work with Active Iron, so obviously I'm very pro them, but Pregnacare or any of them do that. So that's continue taking that.
Any reasonable blood loss, it's worthwhile taking some sort of iron.
And in fact, I'm a big proponent of taking iron actually earlier in a smaller amount right the way through. I've done a lot of work on it. It actually is scientifically supported now. But also ask for help, postnatally, in the way we talked about birth plans. And even a more important plan is your postpartum plan. And in this time of COVID, when things can be cut off, plan maybe to have somebody else in your bubble. And that's an essential journey. So somebody coming to help you postnatally is an essential journey. So that is absolutely within the rules allowed. So, plan for your little bubble to maybe include a grandparent or a sister. And as you know, I am the biggest doula fan in the world. Doula is not just for Christmas. A doula is not just for labor. But I relied heavily on amazing postnatal doulas. And they were the best money I have ever spent in my life. And can also, there's lots of different plans. And I know, Kitty, you do lots of different care packages. So for a lot of people, it is, instead of getting a load of baby gifts, maybe get a few vouchers for a few hours with the doula. It's a much nicer gift.
Some lovely postpartum meals as well. I think there's nothing nicer than just, I think, love through food. I mean, I'm such a feeder. Part of why I think I love being a postpartum doula, but there's so much in giving a warm, nutritious meal to someone. I mean, look, Pete can cook, but he's not a fantastic chef. Whereas my mum coming over with a lovely hearty lentil soup or something after a baby was just, oh my goodness, like I felt so cared for. So that's a huge part of it. And you can also sort of freeze bits and pieces. So you can freeze things like pre-made unbaked cookie dough. So you can have them ready to go, just throw them into the oven so you don't have to think about it, but lovely fresh cookies, nice and warm. That's I suppose a great one. Have you got any more?
What about Deliveroo? Deliveroo made my life a hell of a lot easier.
Oh yeah, we don't get Deliveroo. We're in the middle of nowhere.
But there are meal planning services that you can get a really nutritious 7 days worth of meals that will, there are lots of different companies that are offering that now. And don't forget that your big job when you become a new parent is just to focus on yourself and your little human. So, think outside the box with regards how to support that. And if somebody else can make a dinner and drop it down or do it, then let them, is what I'd say.
Absolutely.
So this is the one for you.
People like to help, don't they?
They love to help, and people can't help at the moment. So if somebody's like, oh, I'd love to visit you, instead of sending flowers, send, a voucher for, somewhere nice to eat or something like that.
Yeah.
There's lots of different ways to support new mums. So, and food is always a good one. So this is one for you. If the teat is only half full, this is a great question. If the teat is only half full, doesn't that mean there's a lot more air getting into the bottles? So I think that was, yeah.
They just blow it out through their nose. So that's the answer to that one. Nice and straightforward.
And again, that highlight is on your grid and it's excellent.
It's a little bit vintagey, but yeah, it's me sitting at my kitchen table.
I love it, vintage highlights. So collecting, another one for you kids, collecting colostrum, 34 weeks pregnant, congratulations. The hospital gave me syringes after inquiring, but then I heard I shouldn't have started collecting yet. What is the ideal time to start? And is there anything wrong with the 1 ml that I was able to hand express the other day?
Oh, fabulous. Good woman. 1 mil is amazing. Firstly, I just have to say that how much you manage to sort of collect or harvest antenatally, so before your baby arrives, is no indication as to how much milk you will make once your baby's actually here. So please don't be focused on the volume. It's much more to do with the skill of hand expression itself, because that's what's really, really vital for once your baby arrives. So it can be really helpful at different stages actually in your breastfeeding journey. So I personally err on the side of caution with this. There is a very limited amount of research when it comes to both antenatal expression, but also with nipple stimulation. One of the things that happens with either breastfeeding through pregnancy, having sex, nipple stimulation, and hand expression is that you have that release of oxytocin.
Or
And
masturbating. That doesn't make you give birth, but they would.
exactly, no, totally. So the research all says, look, it doesn't point us in the right direction of there being of it triggering labor. However, from a lactation consultancy perspective, since I'm not your care provider, I would say run it by them first. If there are certain indicators that you have, maybe for a threatened preterm labor, if you have twins on board, if you have a placenta that's covering or partially covering the os or the opening of your cervix, they are all factors that would negate you or outrule you from being a good candidate for doing antenatal expression in case it were to bring on labor. The verdict is still out in terms of whether or not it actually can bring on labor at all, unless your baby is ready to come. So I always say err on the side of caution, start at sort of 36 and a half, 37 weeks. And if you are to sort of notice any surges, particularly with any irregularity or any kind of tightenings during that time, that you just stop what you're doing. But from 37 weeks, once you've cleared it with your care provider, go for it.
Another one for you. Tips for pumping while breastfeeding. Do I pump if my husband is giving express milk via bottle to keep my supply up?
Okay, so pumping while breastfeeding is a tricky one because you can actually give yourself more work. You might start to realize as you do a little bit more pumping that there's a little bit more involved with the pumping than it is just putting the baby on the breast. So having a little think about what exactly the pumping is doing for you. So unless you are, using it for either for a little break for yourself, if it's about getting your partner involved, if it's about, you having to leave the house for work or whatever it might be, thinking about, okay, well, when is that? Why is it that I'm doing that at that time? Thinking about getting other ways of getting your partner involved. So feeding your baby is not the only way. I always like to think of your partner as being in charge of the arts and entertainment sections. So they get bath time, massage time, baby wearing. They can sort of do singing to your baby, reading to your baby, all of these other lovely things. So it doesn't have to be feeding is all or nothing. When it comes to pumping, if you are, it's not necessary to pump to bring your supply up if your supply is okay already. So you would want to make sure that your baby is meeting their developmental milestones, that your baby is having plenty of wet and dirty nappies, and that your baby is, their weight is kind of going along that nice little curve that we like to see. If you're talking about pumping because you want a little bit of a breather or there's other kind of reasons, I would say the best time to pump is first thing in the morning. That's generally speaking when your prolactin, so your milk making hormone, is sort of peaked from the night. So your prolactin is highest generally around the hours when you would make a baby. So as soon as the sun sets and then just before the sun comes up. So it's still quite high in the morning, so sort of around 8 o'clock, 8 o'clock in the morning. Doing a little bit of pumping for sort of 15, 20 minutes or so then can be enough for a little feed. But just being mindful of the fact that if it's going to become a regular occurrence, that you're sending quite a clear message to your body when the baby's getting a bottle as opposed to feeding in the breast. So remembering that the concept of an empty breast makes more milk, in the opposite of that, a full breast makes less milk. So what's happening is your body's getting a really clear message that, okay, my baby doesn't need to be fed at this time, so I don't need to have milk available at this time. So if you're thinking about doing a degree of sort of mixed feeding with pumping and breastfeeding, just making sure that you're kind of looking at, sending a really clear message to your body. It might be worthwhile checking out the combination feeding highlight that I have on my Instagram page.
And do a prep class and you'll kind of be able to kind of tease out what might work best for you. So can you eat after you've had an epidural? Suggestions for snacks. Yeah, this is a complex one. Most hospitals will very much encourage you not to. But if you have an epidural in for hours, so basically the medical concern is that you can get the movement of your gut is a thing called peristalsis, and there is a very rare complication that an epidural can actually cause, and that to slow or even stop. So they recommend that you don't, but that's not to say that you absolutely can't. So you can have a couple of different things in your bag, like clear kind of glucose sweets and stuff that'll give you a little burst of energy. But again, there are always ways and means. So talk to your midwife and your antenatal educator on that one. There, I didn't get myself in trouble there, did I?
Not at all.
And then any tips for increasing platelet counts? Mine is decreasing week on week and worried about labor if it continues. Currently at 120. Okay, so 120 isn't scarily low. Just I've seen way, you can still have the option of getting anesthetics usually when it's over 80, but I don't know the reason behind why yours is dropping if you have something else going on. So hopefully you've had a hematology review. So a hematologist is a specialist in looking at the medicine of the blood, so the science of the blood. So ensure that your care provider has given you a referral or at least a very decent anesthetic review, even if you're not choosing. Anesthetists are experts in all things blood related. So they will also be able to make a plan for you if things continue to drop, in that there are things that they can do in the hospital. But I don't want to complicate things because I don't know but there's nothing you can really do, to be honest. So just make sure that you've got a hematologist to mind you.
Yeah, that's awesome. I keep losing my spot in this. How are you doing?
So no, I have it here. So just going back to the baby grow vest question, when I was looking at multi-packs for my bag on the department store websites, newborn was £7 and 1 month was about £10. Would you be better just getting the £10 size? You could. It's about budget as well. Like you, but if you end up having a baby that's more petite, so like 2.5 kilos. Kitty's gone. 2.5 kilos, the £10 one that's kind of double might be kind of swinging on them. So and if the £7 one, you can always cut the legs off it if it's a bit small, but just borrow stuff as well. You don't have to buy everything.
They go out so very quickly, don't they?
Yeah, like so much. So yeah, I mean, like if £10 is absolutely fine. Like don't feel the pressure that they need. The baby doesn't mind. Thanks. I was told I'll get a referral to hematologist if it dropped to 100. Yeah, but I would request one. So I would just say, I'm really worried about this. I want a referral, and they will refer you. So they're providing you with a service. It is their job to refer you. And then, would you put bed pads? This is a great question. Would you put bed pads? So that's Inco. They're called Inco sheets, which stands for incontinence. I'm always afraid if I bleed too much during the night. So the great thing is, if you're in a maternity unit, they have an unending supply, so you don't have to worry about it. And in fact, you can always get a couple to take in your bag home with you if you're worried about your sheets at home, but don't worry about the maternity.
Now you're going to get in trouble.
No, but it's their job. Don't be worrying about you bleeding over their sheets. It's their job. So
almost to be expected, because the seats in the hospital beds are so awkward and crunchy and
so uncomfortable. Like they're just
not alone for breastfeeding mums.
Yeah, they're just, and like the little piddly pillows. That's another thing I forgot to say. So important. Take in your labor bag, as well as having underneath your arm, take a lovely pillow from home that smells like home, that's lovely at home, because the ones in hospital are not great. Okay. Another great question, Kits. How soon should you start talking to your team about birth plan on 26 weeks?
How soon would you start talking? I mean, I think 26 weeks is sort of perfect timing to start having the conversation. The good thing is, starting that conversation early is never going to be a bad thing. If, they read through it and they go, yeah, cool, all of this looks great, sign off on it, off you go, take another copy and put one on the outside, then it's done and dusted. If you actually end up having the conversation, they say, oh, we're not too sure about this, you might have to do a little bit more research around this, or this is actually the way we do things. It gives you plenty of time to do further reading, but also to sort of change how you might see things, sort of moving forward. The last thing you want is to have a read through, with your care provider at 37 weeks and then go, oh my gosh, we're not going to tick any of these boxes. We don't do any of that stuff here. So it's always nice to know sooner rather than later, I think.
Absolutely. So we're tricking on now. So we got
to come back to the other ones another day. What do you think?
Yeah, we only have about 4 left though.
Oh, cool. We'll go through 4. We can do 4.
Yeah, why are so many IVF babies induced at 38 weeks or C-section? Very, very good question. I had heard that lovely saying, there is an overabundance of caution. So basically that there would be, the line that we would be given is, you've worked really hard to get this baby, we just want to make sure that nothing goes wrong. The science doesn't back it up. So ensure that if it is being suggested, it's being suggested for the right reasons, because there's an actual medical indication that they would have, like babies shouldn't be induced at 38 weeks. Anyway, that's a whole different conversation. Even though there's a trial in one of the Dublin hospitals, which I'm not too happy about, but just always make sure that when somebody's advising you or suggesting something, really question on the efficacy of what they're doing. So if I don't do this, what will happen? And always use your brain. So what are the benefits? What are the risks? Are there any alternatives? What does your intuition tell you? And what do you do nothing? And that can be put into anything that's suggested to you. And any care provider worth their salt will very, very, be able to back up anything they're suggesting with actual evidence.
That's exactly it. And it's a funny one as well, because it comes from the blanket statement of, yes, well, if you've had IVF, there must be something,
inherently dangerous about the pregnancy and bound to go wrong, when that isn't actually borne out in the evidence. But also, if you are incredibly nervous and it's something that you want, it's your choice too. So, just always make sure you're number one. This is a good one. Group B strep. I was tested early on for this and it was positive. I asked to be retested as it comes and goes, but they say this wasn't usually done. Can it be done? Of course it can. And I don't want to take antibiotics unnecessarily. So about 30 to 35% of women, if you took 100 women off the street, between 30, sometimes say 40, some say 20, but we'll say between about 30% will be group B strep positive, and they won't be aware of it. For most people, it doesn't cause a problem. So absolutely you can be retested, but again, hospital policies can dictate. Of course, if you're getting antibiotics, it has to be informed, but hospital policies can change, but absolutely get retested if something that you want. And again, this wasn't usually done, oh God, what a line. Doesn't matter if it isn't usually done. I would like it done. Thank you very much. They're providing you with the service. It is their job to ensure that they're taking care of all of your needs. That's our job. That's, what we do. It's, so I'm worried about that one as well. The reason why I should be induced prematurely just because I did IVF. So again, this is a really important conversation that you need to have with your care provider, and make sure that whatever is being planned, that you're fully on board with it, and that the reasons are valid, and that you're on board and you understand that it's not just this blanket statement that, you've had an ICSI or an IVF or whatever, and this is what we do. Doesn't matter if that's what they do. What are they going to do with you? What do you want? What does the evidence tell you? I put explaining labour options to me in brain format in my birth preference to get them to talk through what they want to do something and what's the alternatives, or if I do nothing. Great idea. And it's a great thing to kind of remind you when you're asking questions. And I think this is the last one.
We have 4 more in the another hidden box.
Oh,
We'll fly through them. I'll call them
okay.
out.
Yeah.
Main worry about going to the hospital at the right time, 45 minutes away, but conscious I won't be allowed in until far enough into labour. What's the ideal time to arrive to head at the hospital, to remain calm but arrive at good time? That's a really good question. Actually, I was at a birth. I lie. I was supporting this person in early labour specifically for that reason, because their biggest concern was that they wouldn't arrive at the hospital on time. So having somebody there, either hiring a doula or somebody to support you who is familiar with, timing surges and being aware when is the right time to go in for you. Also, to download a contraction timer. So generally they will let you know once you're having regular surges that are lasting a certain amount of time. So I always think for 45 minutes away, or anything kind of in and around the hour, I always think about your 411. So you've got surges that are lasting a minute, that they've been sort of happening over the duration of an hour, and they're coming sort of every 4 minutes or so, is a nice kind of guideline. Can you start pumping before 6 weeks? I live in a European country, hello, where they will routinely get you pumping in hospital. I'm an open, go with the flow kind of person. So I'd be on for this. I would say no if there's no issues with, my primary concern, particularly in those really early days, is getting breastfeeding really well established. So getting your baby well latched at the breast, and getting familiar and confident with your baby feeding at the breast before you do any work involving a pump. If for some reason within the first 6 hours after birth your baby hasn't fed at the breast, or you've been separated, your baby's in the NICU for instance, that's when you would want to be getting pumping. How does the Hackel pump work? Sorry, Avril, these are kind of breastfeeding you ones.
You know what we might do, Kitty, because we're kind of really running over time, and actually my battery is down to like 4%.
Oh no! Okay,
I've screenshotted the last couple, and what we'll do is we will do a live early next week and address them, because I also don't want to fly through, because
I know. I feel like we're answering this fully then.
Hopefully we have gotten around to your question, and also you can send in a couple more if you have them. What we'll do is myself and Kitty, because we just love hanging out together, we will do a little live early next week, and we will answer all of the ones. I've screenshotted them, so all of the ones that we haven't got a chance to get to, we will get to and answer properly for you.
Super. That's a great plan.
Yeah, that did not just fly. That was an hour 45. My goodness. Just to really thank Kaliedy for inviting us both, and to really thank all of you for sticking with us and for attending. As you can see, myself and Kitty could literally talk forever about this stuff.
For Ireland. Not a bother.
Just for all of you to know, you are all amazing. You're growing humans. Like, that is a superpower. So you're really important, and your experience is really important. And look what you're doing. You're educating yourself. So amazing. Well done.
Fantastic.